How's everybody doing?
Good.
Red,
Good, good, good,
everything
good,
good, Red.
How
good.
you doing, Pastor?
I'm doing good. I'm doing good. Let me put
All
my
right.
let me put my headset on my head, then we'll be ready to roll. I
All
want,
right.
want to thank everybody for joining us today for our mental health ministry. I think we have a. Let me change real quick to the headsets, and we are good. Right. I want to thank everybody for joining us today for our mental health ministry. I think we have a very good discussion that we have planned, and I'm just appreciative of you all taking the time out of your schedule to come and get this information. Why don't you do me a favor and go ahead and share the post if you're watching on Facebook, Twitter, or YouTube. Go ahead and share the post so that we can make sure that our community gets this much needed information. Again, everybody's watching on Facebook, YouTube, or Twitter. Go ahead and share the post, and we'd be extremely, extremely appreciative. All right. All right. I think we're in good shape. I'm not seeing something that I'm wanting to be seen. But I'm going to, while I get this sound worked out, I'm going to put it in the hands of our very capable leader of our mental health ministry, Sister Roxalina Rawls.
First, giving honor to God and His authority. Good evening, everyone.
Good evening.
How is everyone doing this evening?
Good.
Good, good. My name is Roxalina Rawls, and I'm one of the coordinators of mental health ministries here at Greater Bethel. And Pastor Rawls, again, I appreciate another opportunity to share information and have a conversation on our mental wellness. I just wanted to start by saying, society has done a good job in intentionally programming us to be aware of mental health only during the month of May. My thoughts are, what about the other 11 months and the 3 of the year? Should we not be aware or even care about our mental health? I strongly believe God loves us so much and wants us to be aware of the care we give our mind, which is our mental well-being, our body, which is our physical well-being, and our spirit, our relation with God on a regular basis. So with that being said, I will continue to remain obedient and talk about mental health throughout the year. My topic of discussion this evening is bipolar disorder in the African American community. Slide 2, Pastor, please. Here is a collage of photos displaying individuals who are well known by societal standards and are successful at their craft. However, each one of them have experienced bipolar disorder. And if you look closely, you may recognize some of the individuals. I see Kanye West, Jennifer Lewis, Chris Brown, Mariah Carey, and I think there's another person there. I'm trying, DMX, who's a rapper, and Chris Brown. But what about those individuals who are unknown and are suffering silently with this disorder? How can we help them? Maybe by having a better understanding and being more informed, we can help them as well. I've noticed people throw around the term bipolar very loosely, but do we really know what it means to have bipolar disorder? By doing so, it can undermine the daily struggles and or challenges of those who truly live day in and day out and try to cope with bipolar and bipolar depression. On the other hand, just because people have mood swings and highs and lows, it does not necessarily mean that they truly have bipolarism. So within the next 50 minutes or so, I would like to share with you information based upon my research and what I know, having worked with some individuals who have bipolar disorder, to clarify some misunderstandings. Pastor, slide 3. According to statistics, it is estimated that some 2.4% of our population, which is 330 million, that is close to 1 million individuals in the United States, will experience the conditions of bipolar in their lifetime, according to the National Institute of Mental Health. So chances are there may be someone you know, maybe a family member, a friend, or coworker. And other facts about people with bipolar are there was a survey taken by NAMI, which is the National Alliance on Mental Illness, a few years ago, that people with the condition are unreliable, violent, or their behavior is a choice. I have been able to, through my research, to determine that this is not a true statement. Some of their strengths and characteristics are, number one, they have high IQs. 12 risk genes for bipolar disorder were also linked to intelligence. And 75% of these genes, bipolar disorder risk was associated with higher intelligence. Fact number 2, bipolar is called a genius disease. Those with bipolar are more creative than your average person. Fact number 3, bipolar people overthink a lot. They are obsessive thinkers, and it's fairly common as part of the disorder. And the final fact is positive characteristics in bipolar people found a strong association with 5 love qualities, and they are their spirituality, empathy, creativity, realism, and resilience. Slide 4, Pastor. What is bipolar disorder? And I would like to show it's a small video, about 3 minutes. Let's take a look at that, and then afterwards review what we've heard.
Percentage of the 330 million. Did you say one million? 2.4. But did you say 1 million?
Let me see why that video is not coming up. This is the video right here.
Mm-hmm. Just let us see. Okay.
All right, is this a video right here?
Yes.
Okay, let me see why it's not coming up.
That's 7 million. You said 1 million.
Okay, here we go. All right.
Thank you. What did you say?
It's 7,920,000. $1,920,000.
Bipolar disorder is a mental health condition that affects a person's day-to-day interactions, behaviors, mood, thoughts, energy, and ability to focus. There are 3 different types of bipolar disorder: bipolar 1 disorder, bipolar 2 disorder, and cyclothymic disorder or cyclothymia. All 3 types cause symptoms of either mania or depression, or both. Some examples of manic symptoms are unusually high energy, talkativeness, distractibility, and less need for sleep. Some examples of depressive symptoms are feelings of extreme sadness, lack of energy, lack of emotions or motivation, hopelessness, and guilt. The difference between each type of bipolar disorder comes down to when they begin and how severe the manic and depressive symptoms are. Bipolar 1 disorder typically begins around age 18, although onset can occur at any point in someone's life. A person with bipolar 1 disorder will experience manic episodes that are present for at least 7 days and can be so severe that the person may require hospitalization. The person may also experience major depressive episodes or symptoms, although some people with bipolar 1 may only experience mania without any depression. A person with bipolar 2 disorder will experience episodes of both major depression and hypomania. The symptoms of hypomania are the same as mania, but they are less severe and only last up to 4 days rather than a week. Cyclothymia can begin as early as 6 years of age and may eventually develop into bipolar 1 or 2. A person with cyclothymic disorder will experience hypomanic and depressive symptoms, but never to the extent that they qualify as mania or major depression. There is no single cause of bipolar disorder, but research shows that it may be related to several factors, such as genetics, a person's environment, and brain structure. It is common for people with bipolar disorder to have other mental health diagnoses, such as psychosis, anxiety disorders, eating disorders, or substance or alcohol use disorder. Bipolar disorder is a lifelong mental health condition, but with the help of treatment provided by a licensed mental health professional, it is possible to reduce and manage the symptoms. Bipolar disorder is usually treated with a combination of medication and psychotherapy. If you or someone you know has bipolar disorder, don't be afraid to ask for help, and remember to be patient. Treatment takes time, and it is important to stick with it to feel better and enjoy a healthy life. If you're a mental or behavioral health provider seeking information on evidence-based treatment, check out our multimedia solution for continuing education and shareable patient resources at psychhub.com.
Okay. I gave you, prior to showing the video, I gave you some statistics. And our family mathematician, my husband, 2.4% of the 330 million. And according to his calculations, it should be 7 million. So I don't want you to go away with the incorrect information. So there's more people.
920,000.
Okay,
If you want to.
7.9 million. Yeah, 7.9 million. So I just wanted to just clarify that. Okay, thank you. So slide 5, which we're at, let's do a review of the information that we just heard on the video. The signs of bipolar, they can start in the teens. It could be 11, 12 years old, or maybe a little bit older. And at the end of the presentation, there's a video with a young lady that describes what she experienced. And her symptoms started when she was in her early 20s. So it can vary from person to person. And then it can also emerge later in life as you get into your older adult years. It can be life-threatening. It can be a life-threatening illness, and it cannot be handled alone. And 1 out of 5 persons were found have committed suicide as a result of that. Slide 6. The mania. The mania under bipolar 1 disorder, it can last 1 week and can be present for most of the day and every day. And some of the symptoms are excessive energy, high restlessness, racing from thoughts and rapid talking, denial that anything exists is wrong, extremely happy feelings, very highs, and also there can be lows, easily irritated, needing little sleep, unrealistic belief in one's abilities, poor judgment and rash decisions, substantial and unusual behavior, increased sex drive, substance abuse, aggressive behavior, and paranoia. Now that's under bipolar disorder 1. Under bipolar disorder 2, it does not have to be intensive and manic episodes that you see. The bipolar 1 only lasts for the 4 days. Bipolar 2 only lasts for the 4 days. Instead, they experience depressive episodes and hypomania, which is less extreme version of the mania. So what does the depression look like? And that would be slide number 7. There could be a poor appetite or eating too much, trouble sleeping or sleeping too much, the 2 extremes, nervousness and worry, loss of interest and withdrawal from usual activities, feelings of sadness that they just won't go away, irritability or restlessness, lack of energy, not having the desire or even the strength to do anything, feelings of sadness and worthlessness, or maybe even guilt, inability to think or concentrate. May start one project or one thing that you're working on and just jumping from one thing to the other. Repeated thoughts of death or suicide, chronic pain or other physical problems that don't respond to treatment. So this could be physical pain in any parts of your body. You go for treatment and it's no response. Increased risk-taking behavior, including reckless driving or substance abuse. Slide 8. Psychothematic disorder. People have periods of both where they have the high mania and depression for at least 2 years, but the severity of these episodes do not quite meet the definition of bipolar 2. So let's take and pause for a second. Are there any questions? It's a lot of information to digest. Any questions? Okay. Let me give you a classic case that I have been following from time to time. And I think that we all may be, or some of us may be familiar with Kanye West. And just going back and looking at some of the experiences that he had and how bipolar has affected his life. And I think it's a classic case of bipolar disorder 1 and depression. In some of his, and this is what has been reported throughout the news, the erratic behavior, extreme and intensive emotional states, risky behavior and irritability, prone to working around the clock and doing many activities at once and scheduling more events in the day than can be accomplished. I just want to go back as an example of the erratic behavior. I don't know if anybody ever saw this when I was one of the awards programs where there was, I think it was a music awards program, when they announced one of the artists had won this in this particular category. And I can remember seeing him racing up to the platform and literally taking that award away from that person and saying that it should go to somebody else. That type of behavior where you don't care what you do, how you do it, I'm going to do it because this is what my mind is telling me to do. False beliefs or false perceptions. I also remember, and this was in 2020, where Kanye West announced that he was going to run for president of the United States. He felt within himself and that he was able to accomplish that, do that, and be successful. Another example of the bipolar disorder 1 and depression, using Kanye West as an example, exaggerated, puffed up self-esteem. On one of his albums, on one of his tracks, I guess it was titled, "I Am a God," where within himself, this is what he felt and he projected at that particular time. So again, I just wanted to take those characteristics that exist to show how that is played out in someone's everyday life that has the bipolar disorder 1. And I also remember where it was a very difficult time for him, where he had lost his mother. His mother had, my understanding is his mother went in for a routine operation, and within days, she passed away. And I know that that was a very dark and sad period of time in his life, where he had severe difficulties in trying to move forward with his life and his family. Any questions? Any comments? Okay, slide number 9. What causes bipolar disorder? Brain chemistry, the chemistry changes and there is an imbalance, or it could be genetics. Maybe they're close relatives, and it could be relatives maybe from not only this generation, from past generations. Drug and alcohol abuse. More than half of the people diagnosed with bipolar disorder have histories of substance abuse. And the 4th item is stressful or disturbing events. Disturbing events, things that you may have experienced throughout your life that maybe you have just depressed that, and later on it shows up under a very stressful situation. Slide number 10.
So with this one right here, where it says drug or alcohol abuse, and I can't diagnose anybody, but I know, someone that I feel that, probably has some type of bipolar disorder, that is probably caused because of some drug use.
Yes.
But what I noticed is that there seems to be triggers to where, at times they can have just regular conversations with certain people, but then there are certain people that it seems that it triggers. And so when you look at it, you just, feel that they're just trying to take advantage of that person, and because they feel like this is the activity that they can do to kind of get what they want from that person. But it's so extreme, it's so polar to where it probably is bipolar. And unfortunate thing is when people see you being normal at one point and then not normal at the next point, I guess sometimes it's hard for people to 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 look at it as a disease because it seems like you're controlling it. But you control it. There just might be a trigger
Right.
that's causing it to kick in.
You're hitting the nail right on the head. You're right. A trigger takes that mind back to there's something that's triggering that mind, and they flip, in a sense. They flip back to that, and then they come back. But again, drugs or alcohol abuse can play a major role in that.
So sometimes it's kind of difficult, families really probably just need to kind of be able to sit and just listen, because sometimes it's hard to see it as a disease, because you're not looking at it as a trigger. You're looking at it as though they just, and so it's probably a lot of people out there that are, homeless or in certain situations that, family members just think, well, this is just what they want. But it's something that's going on in their life that, we just got to kind of take a step back and see that, this actually could be a disease.
Absolutely. Good point, Pastor. Absolutely. Absolutely. And then, later on in the presentation, it go through in terms of, what can we do as people when we see this type of behavior occurs in family members or coworkers or friends or whatever. What should we do as individuals that are on the sideline? How should we respond? What should we do? But good point. Excellent point. Slide 10. How is bipolar diagnosed? Is there any specific test? And I'm going to let Dr. Judith Joseph speak on that, our video guest.
So typically when I see a diagnosis, in front of me without meeting the patient, just through the medical records, and I see bipolar disorder in a child, I just really put on my curiosity hat, like, is this truly bipolar disorder? Because it's often misdiagnosed and it's so rare. By the time a child has come to me, they've already seen a pediatrician, they've seen a counselor, they've seen a psychologist, they may have even seen a neurologist, and then they may have gone through neuropsych testing. But by the time they come to a child psychiatrist, they've been through the ringer. That's the majority of cases.
Now, we often discuss how many mental health conditions are misdiagnosed, but why is there a correlation between a bipolar misdiagnosis with a depression diagnosis or vice versa?
So this is interesting, and I see this in my practice, and I'm so glad that the data and the research reflects this. A lot of times, people who have a bipolar disorder diagnosis, they spend the majority of their lifetime in mood states that look like depression. This is the part where I like to really emphasize, because a lot of times I have people walking around with something called high functioning depression. And, their functioning is actually not impaired, but the depression is so severe and it's so excruciating. It literally feels like pain, but they're just kind of like trudging through life, So, you have this cluster of symptoms for 2 weeks or more, and it's not caused by something else. It's not caused by COVID. It's not caused by cancer. It's not caused by substances. It's truly an organic depression. So you can have a depressive episode. This is important. You can have a depressive episode and not have major depressive disorder.
Yes.
And so you can have depressed episodes within schizoaffective disorder. You can have depressed episodes, within bipolar disorder.
Yeah.
But having a depressive episode alone is not enough to diagnose you with unipolar, or what we call major depressive disorder. Because if you have had a major depressive episode, but you've also had a hypomanic episode, a truly organic one, not one caused by substances or illness, then that's more like a bipolar 2, right? You had a hypomanic episode and a major depressive episode in your lifetime that was not caused by a substance or an illness. Or if you've had a manic episode plus a major depressive episode, we're looking at bipolar 1. So, you really want to be careful about saying, I've had a depressive episode, therefore I have major depressive disorder, unipolar depression. And that's not necessarily the case. And so what happens is that you have someone who has symptoms of depression. They have low mood. They don't enjoy things, something called anhedonia.
Yep.
They feel guilty. They have no energy. They don't enjoy sex as much. All these things, low appetite that look like depression. They have a depressive episode. Every now and then, they may have a manic episode that wasn't caught or wasn't witnessed, or wasn't reported to a provider because the depression is just so much more common. That's why people who have bipolar disorder tend to get misdiagnosed because only the depressive episode is seen or reported.
I've talked to some people living with bipolar disorder, and a few of them have mentioned to me that in the early days of experiencing the symptoms, they never went to a doctor or a mental health provider when they were manic. They felt great. They had energy. They might not even realize that they haven't slept in, a day or two or even longer, but they just feel good. So why go to a doctor when you're feeling fabulous? But then they come in on their depressive episodes, of course, because you don't feel good. And then if that's all the provider information the provider is getting, the depression diagnosis makes perfect sense.
Something like 1 in 5 kids will have a depressive episode in the age of like adolescence, right? Bipolar disorder is a lot less common in the general population. You have some stats that say it's as high as 2.5%. Other stats will say it's like more like 1%. It's not as common. It's not as common. And you have to remember that most people see either their pediatrician, their family medicine doctor, or their internal medicine doctor. If you go to your provider and you just happen to be in a major depressive episode, then you're going to get that stamp of major depressive disorder when it's not the same as having a major depressive episode. This also involves the patient and the patient's family because we're all a part of this fact-finding journey. We're all trying to be curious and inquisitive about what's happening. So we're all in it together. We're all going to be a part of this solution and this treatment plan.
Okay. So, from that, my analysis of that is it can vary in each person. It's hard to diagnose because as Dr. Judith has said, usually people go in, when they're feeling, I was feeling great, but when they're manic, what does that look like? And it can vary from person to person. So,
what's the definition of manic again?
When you have those characteristics that I have listed before, where you're into your excessive energy, restlessness, nothing's wrong with me. You deny there's no problem. You have those highs, extremely highs, and very lows. You're not able to sleep. You sleep very little, and you poor judgment, increased sex drive. Just being not responsible, and then going into substance abuse. Whatever you're doing, it's either excessive. It's excessive, high, or low, and you're paranoid. Someone's after me. But there again, Pastor, it can vary from one individual to another. Can vary from one individual to another. Any other questions? Okay, bipolar disorder, it can be treated. And again, treated on an individual basis. It could be treated through counseling, mental health counseling, medication, peer support, which could be pastoral, family, friends, complementary care, exercise, stress reduction classes. And then they have another therapy called the ECT, which is the electroconvulsive convulsive therapy, which is, I would say, probably on a higher scale. But there again, it has to be customized to that individual's needs. Slide 12. Most Black Americans with bipolar disorder are going either undiagnosed or untreated. And some of the reasons are because of the mistrust of health professionals based on historical tragic events. And I always say, things have happened in the past. The mistrust, the step that I would take would be, first of all, have an open discussion with that person that you're dealing with, that person that's in the medical profession. Tell them why you feel a certain way and be an advocate for your own health. Do as much research as what you can, and through the research, find out what could possibly fit your needs, and then make a basic decision. Two, the cultural barriers between doctors and patients. Ask for someone that looks like you. You walk into the office and you decide, or the person that's treating you, and said, I don't feel comfortable with this individual. How would they know what I could be possibly going through? Ask for someone that looks like you. It's a lot of us around now that you can be specific. And at the end of this presentation, I always like to list names of individuals that are involved with mental health as counselors, either locally and nationally. Reliance on family and religious community only, rather than including trained mental health professionals. So there should be a unit. The strength comes from working in a unit. Pull people in that are interested in you and feel that they can help you. Again, pastoral, your family, and also individuals trained in that particular field. Talk about your physical problems only, instead of discussing your mental symptoms. You may go in with, I have this chronic pain in my arm or my leg or whatever. Talk about some of your mental symptoms. I'm not able to stay focused on certain things. My mind races. I've been under a lot of stress on my job. Give that healthcare provider the full picture rather than part of what's happening. Socioeconomics, no insurance. Now, I know for a fact there are people at Greater Bethel, myself, and the other care provider, Katrina. There's no charge. If you decide to call the church and talk with one of us, there's other mental health counselors in the community that will work with you on a sliding scale. So if you do not have insurance, don't say that I can't get help. There's some possibilities. And misunderstanding and the stigma about health. Having more conversations like we're having tonight, asking questions, becoming more informed. Let's put that stigma that was in the past, let's put that to rest. Do you know of someone with bipolar? How do we support them? And this is what Pastor had suggested before, had questioned that before. Pastor, would you run that slide, that video for me?
People with bipolar disorder often experience mood episodes, which are changes in mood, behaviors, and daily functioning. They may last for most of the day, every day, or longer. If you know someone living with bipolar disorder, here are some ways you can support them. Show empathy and realize how challenging it can be to experience changes in your mood and behavior. Support them in learning to recognize early signs of mood and behavior changes, such as feeling more anxious or loss of appetite. Offer to help them with routine tasks, such as doing the dishes or offering to run an errand for them. It's important to learn about bipolar disorder in order to understand and encourage effective treatment and support.
Some ideas in terms of how we can lend a support. I would say number one is on the top of the list. Just listen. Just listen. Observe. Don't make judgment. Be empathetic. And it's easy to say, well, that wouldn't be me. Well, we're not them. Just, as I said, just be compassionate. Any questions before I show this last video? It pertains to a young lady who lived most life. Yes.
Rosalind.
Yes, sir.
I'm listening, and I think sometimes when we try to ask questions with people that we have to kind of be careful, because myself have asked, people things, do to see this or that. And I think we need to try to stay focused with professional people, because a lot of times you'll go to people and it's not a match. They're like, I got this feeling like this. Yeah, man, I know what you're going through, man, because I used to, and that ain't what you want to hear. You know what I'm saying? And I think that in a position where you're seeking help and you're trying to be on a private level with it, you just really just want somebody to listen to you and not out hurt you. You say, man, like, I've been dealing with this pain for a while and stuff. Yeah, I know what you're saying, man. I had put Ben Gay on mine, and that ain't what you want to be going back and forth with somebody trying to out hurt you or see can every time they match what you saying and make you feel better. No, that ain't what I'm looking for. All I want you to just listen and really not really just say nothing, because a lot of times I think people just really just need somebody just to pour out a whole lot of stuff that they're dealing with. You know what I mean? And another question I wanted to ask you, I didn't want to ask because it might be stirring up a whole bunch of beans, but what's the difference between the bipolar and when you say somebody's schizophrenic? I might be saying that word wrong, but do they act? I'm saying like, ain't that behavior is kind of like the same? Because you hear those names and then you just start labeling people. And I don't know, a lot of people getting labeled schizophrenic, a lot of them bipolar. I'm saying, real brief, because I don't want to take us off what you was talking about, but I just hear that name more than I hear bipolar, like, oh, he got schizophrenic, he crazy walking down the street talking to himself and this and that. The behavior is what I'm saying, Sister Rosalind. That's all I got.
Okay. Well, to answer your first question, when you said, and I totally agree with you, and that's what we do as therapists and counselors. We listen. And sometimes we feel that we're in the company of someone, we try to help or whatever. Sometimes all they need is a listening ear. And that's the beauty that I see in therapy. When that person speaks, they're getting those thoughts out of their mind and they're hearing themselves. So in a sense, they're saying, oh my gosh, this is what I'm saying. Just to clear the air and get it out. And sometimes that's all that they may need, is just someone to take an interest and just to listen with them. That's therapy. That's therapy. And the second point that you made in terms of what's the difference, two separate disorders. Now that's another topic. And what I'd like to do in a couple months is maybe bring that back and discuss.
Right, that's what I thought. I didn't, I didn't want to, okay.
Yeah, and discuss what are the characteristics, what are the symptoms, and so on and so forth, because those are two distinct disorders. And again, like I said during the top of my presentation, it's very easy for us to throw terms out. But bipolar, whatever, we don't know until, and each person experiences different situations or depression or whatever it may be. But that may be a topic that we may want to speak on in the future.
Right.
Okay.
And because we are very quick to label, man, because I tell you, if somebody's acting different than we are, we'll throw something out there and don't even have a clue. But at least with this workshop, at least you can, feel some kind of compassion or whatever they dealing with, that ministry you might want to apply when you see this, is the ministry of silence.
You
And I
hit it.
think that will stop a lot of just throwing stuff out there, and just be there if they got something to say, and just hear them out instead of trying to fill them out. Hear them out. How you like that?
Abra, and they may even come back too and say,
Right.
"What? You're the first person that even took an interest." And maybe,
right. That's what
okay, that's the first step to being compassionate. So very good points. Well, I would like to, are there any other questions?
Yeah, I think and families have to work together, if you have somebody, that's suffering from that in your family. Because, like, okay, so you're working hard trying to understand that it's a disease. But when one of the triggers is somebody that you love, and it's like, okay, it's a disease, but you're still not gonna disrespect this person I love. And and families really have to work together and talk with one another. And and I just, I remember telling somebody that I really love, I don't mind looking out for this person, but I can't do it when you there, because if that person disrespects you, I don't look at it as I can't look at it as, I don't even think I was even looking at it as disease at all then. I was just looking at just, you deciding to you be disrespectful. But I think families have to work together, because it's only so much you can handle. We're not professionals. And if there's one person that's a trigger that really has the heart of family members, and but you're triggering it, but you're triggering this person that might be rude and disrespectful, you might have to agree, you know what, I'm gonna remove myself from this situation, so that my family can at least attempt to still have a relationship and help the person, because it's probably going to be too much on them if this person is disrespectful to this family member that that everybody loves.
Exactly. Good points. Well, I'm going to, if you can run that last video.
People with bipolar disorder often experience mood.
With the young lady, and her name is Jamie Gathers, and she has a very interesting story. This is about 10 minutes, so if you can run that.
By show of hands, how many of you know someone with bipolar disorder? Okay, so roughly a third of you. Would it shock you to know that 2.6% of the US adult population has been diagnosed with some form of bipolar disorder? Of those, nearly 20% will complete suicide each year. Keep in mind, that only accounts for those who have been diagnosed. Many have not. That number is equal to roughly one person per row in this theater. Now, don't start looking around trying to figure out who it is in your row. After all, it could be you. And it's not as if we're going to tell you who we are. Yes, I did say we. I am one of the 5.6 million Americans that have been diagnosed with bipolar disorder. Now is not the time to avoid me, or worse, start feeling sorry for me, because today I am being set free. This is the first time that I have publicly acknowledged my illness. In fact, most of my family, friends, and associates have no idea that I have been struggling with this disease for over a decade. The first time I was diagnosed with bipolar disorder was in my mid-20s. I had been struggling, but having no clue as to why. I had been suffering from brutal insomnia, feeling deeply sad for no apparent reason. Sure, I had problems, but nothing that warranted my recurring desire to commit suicide. After several visits to my doctor to discuss my feelings of hopelessness, lack of sleep, racing thoughts, and such, he suggested that I may have bipolar disorder. He suggested that I be seen by a psychiatrist to confirm this diagnosis. Being afraid of the label and stigma of mental illness, I refused to even consider or accept his diagnosis. I decided to ignore his advice, and I promptly switched doctors. During the years after my initial diagnosis, I was seen by many medical professionals, annual checkups, well-woman visits each year, and random appointments after coming down from manic binges. Not that I knew what manic binges were at that point. None of these professionals ever asked a simple question: have you ever been diagnosed with a mental illness? And I definitely wasn't going to volunteer the information. Instead, I continued on a downward spiral until I found myself truly struggling to live. So you may ask, what does bipolar disorder look like? Bipolar is the mental equivalent of being on the pirate ship fair ride, swinging back and forth from severe depression that made it impossible to leave my bed for days and made me fantasize about death on a daily basis. Or mania, which had me not sleeping for as many as 5 days at a time, or spending uncontrollably, which led to 2 bankruptcies under the age of 35. One time I actually spent $200 on Post-it notes because everyone needs 40 assorted colors or Post-it notes. Mania also includes being severely irritable for no apparent reason and just becoming enraged at the slightest thing. And then there's the hypersexuality. For the married couples, that may not seem like a bad thing. But let me assure you, hypersexuality is not about sex. It is about the compulsive act the insatiable desire that never goes away. To make it even worse, when it's all over, there is no physical or emotional gratification, only shame. Finally, in 2013, I was exhausted with fighting the battle in my own brain, and I decided to accept my diagnosis. The first thing was to come clean with my primary care physician. I thought I would be given medication and everything would just be wonderful. I was wrong. No one tells you how difficult it is to find the right combination of medications or how challenging it can be to find knowledgeable, empathetic providers, or how the side effects of the drugs are often worse than the disease itself. I guess that's because if they did, no one would ever bother with treatment. This was compounded by the daily struggle to hide my symptoms from those around me. I'm sure many people wondered if I was just flaky or plain rude, depending on the version of me that they encountered. I fluctuated between overcommitting myself when I was manic and failing to meet basic commitments when I was depressed. This resulted in me feeling guilty and overwhelmed. Because of these and other factors, I struggled to get on board with my treatment plan. On several occasions, I failed to take my medications, leading to nearly disastrous consequences. I had gone beyond having suicidal fantasies to making a plan for my exit. I was exhausted from the struggle, and I was tired of being a burden on my daughter. Less than a year ago, a month before my planned date of death, I received the unexpected news that a friend had ended their life. It was devastating. This person was so brilliant and filled with potential. That said, I could understand the feeling of hopelessness that drove them over the edge. I also felt terrible because maybe if I had taken off my mask and revealed my struggle, maybe they could have shared theirs. I wish they had known that I could understand their pain. In the months following their death, I realized that I didn't want the people that I would leave behind to experience the same guilt that I now carry. The question of if my friend's life could have been saved if I had been strong enough to take off my mask will haunt me for the rest of my life. As devastating as it was, that experience saved my life. These days, I'm excited to share. I am hopeful for the road ahead. While I am a work in progress, I have made progress. I am taking my medications, all 7 of them, repairing the relationships that I can, and choosing not to allow my diagnosis to define me. Most importantly, I'm planning my life instead of my death. A few moments ago, I asked all of you if you know, how many of you know someone with bipolar disorder? Now that you've heard my story, all of you can say that you do. Moving forward, if you suspect that you may have bipolar disorder, or if you have been diagnosed with bipolar disorder, have courage, get help. Give those around you the opportunity to support you. And be brave enough to share your story so that others may be empowered to share theirs. Your story may save a life. If you know someone who has been diagnosed with bipolar disorder, have courage. Get educated. Do not be afraid to ask the hard questions, like why are you buying $200 worth of Post-it notes? Those kind of questions. And most of all, have patience. They are doing the best they can. Your support may save a life. Thank you.
Any comments?
Yeah, I got one. I was just sitting back thinking about some things, where we as a people fail is for education. A lot of times our kids will go to school and these psychiatrists in those schools will identify something in your child. And we got to get out of the mindset that they trying to say all Black kids are this and all Black kids are that. Okay, if they tell you your child needs medicine, you might want to check the doses, but they're on to something. And see, what you don't want to do is not nip it in the bud then and stop being so ignorant to the fact that when they grow up and these behaviors seem to get out of whack, it may not be too late, but it could have prevented some things happening later on in life. Because I'm going to tell you something. Only way you get anything just like that is some bad drugs or something like that. But usually time when you got bipolar and these type of things, I'm not a professional, but I know it took time for it to get to the stage where it was identified real bad. But somebody seen something earlier, because you could see a child and say something ain't right. Why he doing this and doing that? And that's where the educational part come in. So these type of workshops, whoever listening out there, when these teachers tell you about your children, go further and investigate and stop trying to think that they're finding fault in your kids because you'll pay later. That's all I got, Sister Rosa. I just know it is real that when they identify something, get on it then. You don't have to deal with the school, but go out and see what they're talking about before you start saying that they're trying to, I don't know them other words, putting your child down and putting all the black children down. No. It's white kids get identified too, but they go do something about it. Some of them. That's all I got. That's some good stuff, man.
I appreciate that. And I had mentioned earlier, be an advocate. Try to get as much information that you can find through workshops and research on your own. And then you make the final decision and see, is this a problem? Is this something that I need to pay attention to and watch and follow through on this? What is my role and what should I do? Any other comments or questions?
One more thing. Stop jumping on all these teachers about your child's behavior when you know before he went to school, he almost cussed you out. See, we uphold stuff and we try to put it all on the system. But deep down inside, you know your children. Deep down inside, you know your relative that they're putting this title on. If you seen it, now everybody else seen it, now it's somebody else's fault. We got to stand up and stand up for what's right and try to make it righter and try to seek help and identify these things before they get out of hand. That's all I got, Sister Roxanne, because things keep coming to me on that. Thank you.
Good stuff. Any other comment?
I wanted to say, I picked up on it as I was listening tonight. I was thinking, love never fails. And the one thing really stuck with me is some empathy. I think we need to share more empathy, and maybe that would help get to the root of a lot of things instead of being so quick to label people. Let's take some empathy and some love. I think that would be on a good on the right place to get started with showing more empathy and a listening ear.
That good points, Dr. Cole, because with empathy, that's showing that you care about and love that person.
Yes, ma'am.
Them first rather than being judgmental and comparing with someone else or what you may think. So good empathy and love. It's a way of support and listening to them, hearing them out, hearing what they. So good point. Anything else? Okay, Pastor has put, and I'm committed to at the end of the presentation in showing mental health professionals who can help locally and nationally. We have two of our own, Dale Harris, as well as Jermisa Lee, are our own that offer that type of help in terms of mental health. And then I've put a national depression and bipolar disorder, a national organization. And if you need any other further information, please call our church. I'll be glad to respond to any questions or any information that you feel that you may need to help yourself, a loved one, family member, whoever. We're all in this together.
Yes,
and
ma'am.
The more work that we do, the more proactive that we are, that stigma needs to go away. Let's talk, open up. Don't keep it in. It concerns us and it concerns our community. It concerns the community. So I thank again for the opportunity, and Pastor, as always. And I just wanted to say this. Now we all know someone that has bipolar disorder. The young lady that said it online, she took off her mask and she put it out there. And she's moving forward. So Pastor, I'll let you have the final word.
All right. I thank you for being prepared and presenting a presentation that I think we all can benefit from. I think that if it's not personal, I think we know someone in our family that
Yeah.
struggles, and Dr. Cole, said the first step is to be able to have empathy, and to even step back and try, not to judge and label,
Yes.
and then attempt to use what we have, and the resources that we know of to see if we can offer some help. And one thing the young lady said, it's not something, it's not just a snap of the finger. You got to figure out how, if medication is the right road, because it's a balance, and you got to figure out what works. And so the first effort might not work just like you wanted, but you just got to be patient. And so that means that we have to have empathy and be patient with people as they try to get this balance, chemically in their mind, and be able to function, and not go into places to where they might unnecessarily take a life, when it could have been avoided, if empathy and things like that could have played a role in making them feel that they didn't have to make a life-changing decision.
Man.
So let's take this information, get it to the people that need it, and you can always come back to the YouTube page and pull it up, if you find somebody that could probably benefit from it. God bless you, and you all have a great one. Roxalina, thank you again.
You're quite welcome. Anytime.
Yes,
Good
ma'am.
job. Good job.
Rose.